is Dr. Zachary Ward at Life and Alignment Chiropractic here in Auburn Hills, Michigan. And this short video is going to explain to you why, if you've had a concussion, why you still might have those concussion symptoms even weeks to months to even years later after what you believe to be your initial concussion injury. So how is concussion diagnosed? Well, it's diagnosed largely by the symptoms. It's kind of a hard diagnosis. Everybody wants to be the hero and pull the kids from the games so they don't get hurt, and that's a really good thing. Concussion awareness for that end is a really good thing. So what are some of those symptoms? Well, you're looking at fatigue, you're looking at mood changes, that's what that says. Headache, abbreviated there HA/neck pain is stiffness. I don't have the stiffness down there. Sleep quality goes down. Concentration ability goes down, and memory goes down. Those downward arrows indicate that the function has decreased. What other symptoms would we be looking at? Well, especially like on the field, let's say in a football game, you'd be looking for slurred speech, decrease in coordination, sense of pressure in the head for someone who's had like a bad hit. You'd also be looking at how the eyes are moving, how the tongue is moving, can they speak? And the reason why you'd be looking for that is because concussion can also be confused or misdiagnosed as a spinal cord injury, or a spinal cord injury can be misdiagnosed as a concussion, which you don't want to have happen, because you definitely don't want to have those folks going back out into the game, number one, with a concussion, and definitely not going out in the game with a spinal cord injury. So one of the major recognized sources of concussion, obviously, are something that they call a brain bruise or a contre coup injury, where if you have somebody's head and they look like a chess piece and not a real person, but if you have somebody's head, they're hitting one end of the head here, and then the head ricochets back, and they have kind of like the strike happening both sides in the brain, causing swelling. Okay, that's like the classic example of a cause of concussion. Well, you also have another one, and it is whiplash. Okay, whiplash is very common for anybody who's ever been in kind of a mild car accident. Even could potentially have a whiplash, and whiplash symptoms, believe it or not, are very similar to concussion symptoms. So what are some symptoms of whiplash? Well, we can take a look at fatigue. Yep, fatigue is a symptom of whiplash. Mood changes do happen with whiplash injuries even years later. Headache and neck pain and stiffness, absolutely, you've got some of that. Decrease in sleep quality or sleep disturbance, absolutely. Whiplash happens 4, 5, 6 months after you can have all these things showing up. Decreased concentration, decreased memory. These are all symptoms of a whiplash. So whiplash causes these similar symptoms to concussion, and it's also recognized as a source of concussion itself. Okay, so maybe you can see where I'm going with this. So if we were to draw kind of a Venn diagram around our whiplash, and don't get too seasick with me as I do this, right over there. We might have some other things related to whiplash that we haven't listed that we would put over there on that part of the diagram. And then we have these items here circled with the concussion. You might have your very kind of amorphous blobular Venn diagram, okay, where you have all those crossover symptoms there in the middle. All right, all marked by the red marks. And so what you have is someone who maybe had a concussion, had a whiplash at the same time, or had a whiplash and then a concussion over top of it, who've been properly diagnosed as having a concussion, but at the end of the day, they've not had any of their concussion symptoms resolved, because a lot of them are actually coming from the whiplash. And why wasn't their whiplash treated? Well, because sometimes everybody's so concerned about the concussion that the whiplash doesn't get proper follow-up. And let me give you an example of what that might look like. There's a university hospital in my area, a major university hospital, that spends a lot of time diagnosing and treating concussion injuries and doing a lot of education on them. They recognize whiplash as a potential source of concussion, but they don't actually treat whiplash. So then what happens to those patients? Well, sometimes they might even fall through the system or go get, some other form of care which isn't appropriate for them, thinking that these symptoms are only related to their concussion. So what can people do if they're facing this kind of situation where they have these concussion symptoms that are still persisting, and now they're being told they have something called post-concussion syndrome? Well, they can actually be evaluated for proper or improper neck mechanics. And one of the places where they can go to do that is with an upper cervical, got that, doctor. An upper cervical doctor is actually a doctor of chiropractic who spends a lot of time and energy understanding how the neck mechanics work, particularly the junction between the head and the neck, because of how it influences the rest of the spinal bones below and the nerve system. So again, concussion and your history should be evaluated for whiplash. Absolutely. There's a bunch of crossover of those symptoms. Some of those symptoms may not resolve until the improper mechanics created by this injury are taken care of. Where can you get that done? Potentially with an upper cervical chiropractor. This is Dr. Zachary Ward at Life in Alignment, upper cervical chiropractic care here in Auburn Hills, Michigan.